going through the presentation. Feel free to write your questions in the chat. I'm going to stop, every now and then, and I'll ask Jackie what questions we have. And then, of course, at the end, we'll have some Q&A. So let's go ahead and get started. I'm going to share my screen with you. Okay, so you should see our PowerPoint here. And Jackie, let me know. You can just text me if this is the right version of the viewing screen. I don't want to get into it and then you all are looking at the wrong one. So while I'm waiting, oh, she says yes, so that's good. Okay, well, welcome everyone. Thank you for attending today's session. My name is Melanie Stone, and for those of you who don't know me, I direct the Community Service Learning Program here at UT Health through our Center for Medical Humanities and Ethics. So this is the agenda of what we're going to be covering today. I'm going to introduce you to our center and our CSL program. We're going to talk a little bit about the grants themselves, why we offer them, what types we offer. There is some special consideration for a few different types of projects in this very special time that we're in with doing community work. So we'll talk a little bit more about doing CSL during the COVID pandemic. And then we'll get into the actual application process. And I'm going to walk you through an application step by step, and then just give you some tips at the end for writing a competitive application. So some of you may have done grants with us before, or maybe you've done some classes or lectures and presentations. So we've been established here at UT Health since 2002, and our mission is to educate our students and our health professionals in ethics and professionalism while nurturing empathy and humanitarian values. And our motto is to prepare tomorrow's healers to act with compassion and justice. So our center is very focused on people doing things with the knowledge that they have to help our community. So our center, broadly, we cover 4 key areas. So you can see them on the screen. It's medical ethics and professionalism, the humanities, which includes literature and art, and then we have community service learning and global health. Both of those programs are using a service learning engagement model. It's just that global health obviously takes place in other countries, while CSL is really focused here in Texas. And so I could go on and on about CSL. Hopefully you all have seen presentations on community service learning before. So today what I'm going to focus on is just one aspect, which is a very big aspect of the CSL program, which is our mini and midi grant funding program. But I welcome you to check out our website at texashumanities.org. Even in this time of COVID, we are still very active, and we're offering virtual lecture series and different things that you might be interested in. So please check it out when you have time. So why do we offer the CSL grants? And so here at our health science, for the most part, community service learning is a voluntary activity that you all are doing above and beyond your required curriculum. And we want to encourage that. We want to help you do that. And one way we do that is to minimize your expenses. And so we recognize that you are students, you don't want to be spending your funds on a community project. And at the same time, the community organization that you're helping is likely not going to have a lot of funds to spend on an extra project that you're bringing to them. So to avoid anyone on either side having to worry about costs as an issue, we've offered this program. The mini grant program began in 2008. And then we also included the larger midi grant program a few years later. I will talk about both of those. And it's a great professional development opportunity. A lot of times health science center students never have an opportunity to work on a grant. And while this is not an NIH level grant by any means, it's still a grant, and it takes you through the whole process and helps prepare you for writing future grants later. So as I mentioned, we have the mini and MIDI grants. Feel free to go to our website, the texashumanities.org, but specifically CSL funding, and that's going to give you the full RFA. RFA stands for Request for Applications. So all of the details that we'll be covering today, you'll be able to see in a written form on our website. So we will start with the mini grants. And so these are grants that are going to help you pilot something innovative. We're really encouraging innovation with these grants. So when you get with your community partner, we want you to think about creative ways that can address health disparities. So all of the community organizations are working with underserved clients, vulnerable communities, so forth. And we want you to figure out some ways that could, with your expertise as a health science center student, help address those identified needs. And so your scope of area can be here in San Antonio. We're also going to tell you about the donut counties that are surrounding San Antonio, which we really want to encourage projects in. And you can work as far south as South Texas on the Texas-Mexico border, with some caveats because mileage is not allowed right now, so our travel is not allowed. So we have to think about things virtually for the moment. So the mini grant awards are for $500. You can apply as an individual if you're working on a project by yourself. You can apply as a group if you are perhaps part of a student organization that wants to take on a project this year. If you are applying as a group or doing the project as a group, you need to designate one student who's going to be the grant leader. So you may have several different types of leaders on your project, but you need one person to be the designated grant leader. That's the person that will turn in the application and do the reporting and work with our office with all of the requirements that you need to follow. You also must have a faculty mentor, so that mentor must have credentials here at UT Health San Antonio, and you must have a partnering community organization. Your funds can be used for project supplies, whether it's medical supplies, educational supplies, whatever it may be. You can use it for printing costs, other types of educational materials, and mileage reimbursement. Like I said, that's a little tricky at the time because we aren't really supposed to be traveling, and so we probably will not be doing a lot of mileage reimbursement with current projects. Any UT Health San Antonio student can apply. You can be from any of our 5 schools. We also have pharmacy students from UT Austin that rotate on our campus. They're eligible as well. So I'm going to now turn to our next type of grant, the MIDI grant, and then I'll stop and see if there's questions so far. So the mini grants are the same idea. We want to, innovate and address health disparities, but this time these should be projects that have previously been piloted in some way. So perhaps the project got started through a grant that someone did last year. Maybe the idea was born out of a class that's doing community health. Maybe a student organization started working on something. Maybe you just worked on a project now, over a time period. And so, the idea is that this is now ready to be taken to the next level of scholarship and activity, sustainability and refinement. And so these awards, while the mini grants were for $500, these are now for $2,000 to $4,000. And so now you have more money to really get that project sustained and do some research with it. Maybe you want to present it at a conference outside of our CSL conference, which I'll tell you more about. Maybe you want to do some publication, and there's expenses involved with getting something published. So it's kind of up to you and your project what your goals are, but otherwise it's the same conditions any UT Health San Antonio student can apply. So let me stop there, and Jackie, just turn on your microphone and let me know if there are any questions so far. And I'll just say, if you have any specific questions that are not necessarily about the general process, but are very specific to yours, let's wait and take those at the end. But right now, this is more about the process.
We don't have any questions right now, but I'll give it a couple more seconds for anybody to send in a question.
Okay, Jackie, we're not able to hear you. There's a very large echo.
Sorry. We don't have any questions out right now.
Okay, great. Thank you. We'll stop again in a little bit. So I talked about finding a project and a mentor. There are different ways. If you don't have one of the two or either of them, you can always contact me and tell me your idea, and I can usually have a pretty good idea of a faculty who might be good for you, or a community partner. But if you also go to our texashumanities.org website in the community service learning section, you'll see a directory that lists past projects, and those may give you some ideas of faculty and community partners as well. So there are different ways you can find one, and just let me know if you're having any requests in that area. So the types of projects that you can do for CSL are very wide-ranging. We have a sample of different types of projects that I'll just quickly show you here to give you an idea. But really, it's more about meeting the identified need of the community partner and what their specific needs are. But just to give you an idea here, the picture in the top left of your screen were students that were helping people, homeless people, and people who were otherwise not able to access dermatology care. And they started working in a church, Travis Park United Methodist Church, to provide dermatology care. And they applied for a series of mini and midi grants over several years. And once they demonstrated that, this actually could work as a long-term sustainable clinic, they did become part of one of our 6 student-run free clinics. And so that just goes to show you may start a project idea with a seed of an idea, and it may grow into something that you weren't even expecting. The picture on the top right was a project several years ago where a couple of our medical students had connections to a very popular barbershop on the east side of San Antonio. And they wanted to do a project addressing high rates of hypertension in African American males. And they, rather than trying to force people to come to us and to our clinic, they went out there where people were. They would gather in this barbershop on the weekends, and not only to get their hair cut, but also to socialize. So they had a good crowd of people. They got the buy-in of the barbers, and they were able to go out there and do some screenings and health education. So that shows you your setting can be very innovative. That could be the innovative part of your project. The one on the bottom left was PA students that were wanting to do health literacy for seniors at a local senior center, and they were teaching them here how to read prescription labels. And then the one on the bottom right is, I believe it was diabetes screenings at a Walmart, and so more of your traditional health screenings out in the community. So those are just ideas of past projects. Now I want to turn to for this funding cycle, we do have some special considerations for projects. The very first one, obviously, probably what's on everyone's mind first and foremost is how do you do CSL during this time of COVID when we can't physically be out there like we're used to, physically working with clients? Well, we have been putting a lot of thought into our response. We are calling it physically separated, socially connected. And if you go to the CSL website on texashumanities.org, you'll see this button here that says CSL COVID-19 response. If you click on this document, it's a live, active document that is gathering the ideas that we are getting from our community partners, other universities here in San Antonio and around the country on ways that we can address needs in a safe way. So a way that keeps you all as students safe. So if you're thinking about, way like maybe there's a topic you want to do that you're not quite sure what to do, I encourage you to go spend some time with this document and reading about ways that you might be able to help the community. The second focus area is interprofessional projects. This has been a focus for us for a number of years. When we say a CSL project is interprofessional, that means you actually have leadership from more than one health profession. Not that you just have volunteers, and that's fine. We want you to have volunteers from all the different schools, but that you actually have leadership who's guiding the project and working as a team. So we encourage that. And then location is a big area that we're really focusing on now. And there's two different maps here. The one on the right is the one I was explaining about the donut counties. So we have San Antonio right there in the middle in Bexar County. And then we have 7 counties that touch Bexar. These are all predominantly rural counties that don't have a lot of resources. These are people that can't use University Health System or CareLink because they don't live in Bexar County. So the funder who funds these mini and midi grants is really encouraging projects in those outside counties because they want to make sure that those people are getting their needs met as well. So when you're thinking about a project that maybe is happening here in San Antonio, since we are doing things virtually right now, think about ways that you can pull in some partners in these other counties, at least one, and that will give you some beneficial points in your review. Not literal points, but your application will be looked at more favorably if you're expanding your reach. The map that's on the left is small here. It's a screenshot, but if you go to our CSL website, you can blow it up and see it much bigger, which we can do later if we have time. And so this is something that you may or may not be familiar with. This is a map of the zip codes of San Antonio. And as I mentioned, we're trying to address health inequities with our CSL projects. Well, this map demonstrates to you the vast difference in health equity based on life expectancy right here in our city. So the very dark blue, which is up the zip codes that are on the very north and central part of our city, those are people that live to be up to 88 years of age on average. Whereas the very light cream colored, where it's almost white looking, those people can, their life expectancy can be as low as 69, simply based on the zip code where they live. I mean, obviously, when you're talking about zip codes, you're talking about social determinants of health, and there's a lot of needs in those areas. So then what we did is we took some red and green pins and we put them in the zip codes where we currently have CSL projects as of the spring. So the red dot means we have one project in there, whereas the green, we have more than one. So you can see our pins right now are mainly in areas that are doing a little bit better. What we're trying to do over the next few years is take projects into the zip codes of San Antonio that have greater needs. So that is something that we're developing community partnerships with, and it's something that I want you to be aware of when you're thinking about where to conduct your project. So I'll stop there before I go into the application process and ask Jackie if we have any questions right now.
No, we don't.
Okay, thank you. So I'm going to take you through the application process kind of as an overview with some slides, and then I'm going to get out of this PowerPoint and take you into the actual application so you can see it, the real version of it. But I want to go through the whole process with you just in case we run out of time or you have to leave early. I want you to understand the general process, and then we'll take some time to go into the details. So this process is you're going to go to our website, to the grant page, and there's going to be a link for Engaged. Engaged is a GivePulse software that our university recently acquired. It's going to be the platform that our university is now using for community engagement. So it's going to be where you apply for CSL grants. It's also going to be where you sign up to do volunteer activities. So not necessarily CSL, but if you're just doing some volunteer activities, you're going to use it. You're going to use it for reporting your CSL data. You're going to manage your CSL flow of your project through Engaged. And so it's going to be a really important software for you to become familiar with. The nice thing about it is by doing that, what you get out of it is a portfolio or a transcript of all of the community service learning and volunteer activities that you ever do at UT Health San Antonio. It's going to automatically put it in there for you, and then you can just print it out in a nice format. So it's going to help consolidate things that have been kind of scattered throughout our university. So you can attend GivePulse sessions. We can talk more about that. But I want you to know right now that's what you'll be using for the application. So if you applied last year, you used a different system than what you're going to use now. But it's really easy, it's super straightforward, and I'll take you through it. You will need to have your mentor, your faculty mentor, listed in the CSL Mentors subgroup in order for them to be clickable in the application. I have gone ahead and put all of the mentors from last year's grant applications into the system, but if you have a faculty who hasn't maybe been a part of the process for a few years or is new, then they will need to be joining that subgroup, and they can do it themselves, or if they can't do it or not sure how to do it, they can have me do it for them. And then you'll need to upload a letter of support from your mentor and from your community partners. You'll have two different letters that you're going to upload to your application. You'll also have a budget form. We went ahead and just created a standard template for you, and another transfer of funds form, which I will tell you about. And it's always a good idea to work in this application as a Word document. That is available to you on Engage. There's a document section, so you can just download the application as a Word document, do all your editing and sharing with your team members, and then just copy and paste it into the real application when it's time to turn it in. And that deadline is September 9th. That is a hard and fast deadline because we have a whole review process set up that has to be based on turning applications in on that day. So this is a screenshot. When you go to our grant program, you're going to see this information, and it'll say applications must be submitted through Engaged. So you just click on that link. And when you click on that link, you're going to log in via UT Health San Antonio. So you'll just use your regular UTHSCA credentials, email, and password that looks like this. And if it's the first time that you've ever logged in, it may ask you once to accept terms of agreement, but it won't ask you that anymore, just the very first time. So then you will come directly to the grant application. This is what it looks like, and this is what I'll go through with you in a moment here. And then just some tips. The person who is actually filling out the application and submitting it, that's who we are going to consider to be the student leader of the grant. And as I mentioned, your faculty will need to be listed in that subgroup in order to be showing up in the application. And I'll show you what that looks So at the end, if you're ready to go ahead and submit it, if you've put your final version in, go ahead and submit it. If you're not quite sure and you want to check some things out, you can just save draft and it'll be there next time you log in. And like I said, it's always best to draft it in a Word document. So this is the document section that I'll show you at the end. This is where a lot of helpful documents are in terms of the application. So a lot of things I'm going to show you are stored right there for your convenience, including the Word template of the application. This is also another document that will be in there. If you are not quite sure what should go into a letter of support from your mentor or your community partner, this gives you some tips on maybe drafting something for them, so it makes it a little bit easier. They can then edit and tweak it. Don't make it look exactly like this, because it's very obvious if you're just copying and pasting this. You know, but it gives you some ideas of how to write a letter like that. We also want to make sure that it has an original signature and that it's scanned to you with that original signature. If it is a faculty here and they want to use their official electronic signature, that's fine, but it does need to be signed, and preferably on letterhead. This is another form that you'll be uploading, and this is called the Transfer of Funds form. So as the student leader, you're going to fill out this top part here. Your mentor will need to fill this bottom part, and this is about if you are awarded a grant, this is where the money will be transferred from our office to your mentor's department. So you as a student won't actually receive the money. Your mentor's faculty department will receive it. And a PID is a project ID. So this designates the department and the ID. And then once the money is deposited there, you work with your mentor to spend it, which we'll talk about too, the different ways of spending that money. You may think this is a little presumptive to go ahead and fill this out when you don't even know if you have been awarded the grant. What it does is, by making it part of the process and one of the documents that we collect, we don't have to chase you later and try to gather it from the different projects, and then we have to submit it all to accounting, and it has to go through a whole flow. And so we're trying to speed up the process by having it ready to go and try to get you your money as quickly as possible. So for the review process, I wanted to let you know there is a committee of people who have been trained specifically how to review these applications and how to use the rubric, which is also available for you to view in that document section on Engage, so you can see exactly what the reviewers will be scoring. This is something that the staff and faculty at the CMHE, we don't actually score your applications because we are too close to each one of you in order to be, you know, scoring it. So we have a group of interprofessional faculty and staff from around the university who do this for us, and then we pool all of the applications and make final allocation decisions. I did want to let you know that if you apply for the larger MIDI grant because you think you have a good case for that, and it doesn't get approved for a MIDI grant for some reason, or perhaps there's just not enough funds to do it, then you'll automatically be in the pool for a mini grant. So you're not going to get kicked out. You'll then be reviewed for the mini grant. And since those are smaller awards, you might have a better chance. You'll just have to, I guess, revise your objectives and your budget in order to meet the mini grant, the smaller mini grant. And so award decisions will be announced no later than September 30th. That is the absolute end date. We hope to be able to announce awards sooner. It just depends on how, if there's any glitches in the review process. So if you are awarded a grant, we are going to ask you to attend a virtual orientation with you and your mentor, where we'll be telling you about the reporting aspect of your project. And so, like I said before, you're going to use Engage to do that reporting, but we want to provide you guidance on that. We'll also tell you about our annual CSL conference that we will be holding in early February. It will be a virtual conference this year with a virtual poster session, but it is required that you attend and present if you are awarded a grant. And as I mentioned earlier, your funds will be dispersed to your mentor. So I'm just going to quickly go over this so that we can get into the application. These are just some general application grant writing tips. Make sure that other people are reading and reviewing your information. You'll see on the rubric that typos are one of the things that you get scored on. And so you want to make sure you're really making a good case for your project and that it's professional and that it is written in complete sentences and has references and all of that. And so projects, applications nowadays are much better than what we used to get in our early days. And so that's why we had to really emphasize the importance of having these applications written in this way. So you can take a look. This PowerPoint will be available to you in that resource document. So you can always come back and take a look at this. This is an example of a good mentor letter of support. And so this isn't something that gets an actual score by reviewers, but if you just look and glance over this letter, it's very obvious that this mentor is involved in the project. They know what the student is doing. They know what their role will be. And, they spent some time on it. Your mentor's letter does not have to be 2 pages long. We just wanted to show you something that was a good example. This is another application resource for you that will really make a big difference in your application. So if you're not familiar with SMART objectives, SMART is an acronym that stands for specific, measurable, achievable, results-oriented, and time-limited. SMART objectives or SMART goals have been used in a variety of professions, and it helps make things very doable. And so we've adopted it for these CSL projects because you have limited time as a student. You have to focus, and we want you to do a project where you can demonstrate some success in the time that you have with the resources you have. So this document here gives you a template for how to write a SMART objective. So as you can see, it's one sentence that encompasses all of those aspects of your objective, and then it gives you an example here. So SMART objectives, in all honesty, are one of the areas that students struggle with the most. So if you can really make sure you spend some time, work with your mentor, work with your team members to come up with some good measurable objectives, it'll help your application a lot. So I'll let you take just a moment to glance at that and decide if the first, second, or third objective is the best example of a SMART objective. Okay, so if you didn't choose 2, then well, 2 is the right answer. So not just because it is the longest objective, but because it has all of those 5 aspects. And this shows you how you can put it all into one objective there. So these are some contact information for more resources with our phone numbers of Jacqueline, who's our CSL program coordinator, and myself. And feel free to email us, and be sure to visit this website to get the full RFA details. And then I'm going to pause here, see if we have questions, and then I'm going to get into our actual application.
I don't see any questions in the chat, but if anybody wants to add anything while Melanie is transitioning into her webpage.
I have a question. My name's Elena. I wanted to know, how many grants are y'all offering?
So we don't have a set number. We base it on the amount of funding that we have per cycle, which is based on funders and other sources of funding that we get. And then we get the scores back from the reviewers, and we will look at the top scored reviews. We'll see how much money we have to allocate. And we really do our best. If it's a good project idea, we will do our best to get you partial money if we can't do a full award amount, if it's a project that's worthy of being funded and got scored high enough. There are projects that don't get a score that's high enough or doesn't meet the criteria, and so those projects will not get funded. But if it's a good project, we really try. So, you know, the applications vary based on each cycle. They can range anywhere from 10 to 30 per, just depending on what students submit. Okay, any other questions right now?
Yes, I have two more questions. How many cycles do y'all do in a year for funding for the grant? And also, what is the time frame for the project? How long does the project need to be to fit the criteria for funding?
Great question. So we do offer the funds twice a year. So the fall cycle is usually due at the beginning of September. This year it's September 9th. And the spring cycle is due in March, usually mid-March. And we kind of base the project timeline on the CSL conference. And so if you're submitting for a project right now, we really want you to be able to present that at the February CSL conference. So your timeline would, you know, most likely be within the fall semester, going into a little bit in the early part of next semester. If there's a reason why you can't do your project in that time frame, then that's something that we'll work with you individually. If you're applying for a spring grant, then you have a bit longer because you'll have, you know, the late part of that spring all the way to the following February. Okay. Any other questions right now? Okay, Jackie, can you see the application on the screen?
Yes.
So when you click on that engaged link that I showed you in the screenshot, it's going to take you to this application. When you go into the application, you'll see that you can just click right here for the full RFA details. We provide it to you in a variety of ways. And then you get right into the actual application. So we start off with a project overview with a project title. We want that title to be short and sweet, so a maximum of 100 characters. That's to make it less burdensome from having to deal with very, very long titles, which it used to happen. Now, if your project is something that's being continued and you want to designate it as, you know, the current year's version of the project, then you can add 2020-21 at the end of it, so we know what academic year you're referring to. The person who is submitting the application, we're going to see who that is because it'll be the person in engaged who is already submitting it, but we want you to write out your name as well, because when you're just looking at this document, you're not going to automatically see who that person is. So this will be helpful so we know who you are. And then you get to choose mini or MIDI grant, like I said earlier. You get to choose which one, and also the requested grant amount. So remember, the maximum for the MIDI grant is $4,000. The maximum for the mini is $500. So we want to know your profession as the person submitting the grant. So you're going to choose which school and program you're with. And then if the project is interprofessional, you're going to say yes or no here. And you get to click off all the student leaders who are representing other professions, so that it's very clear to us. And then we also would like their names written out here so we know who they are. Okay, and then we talked about choosing your CSL mentor. It's not a drop-down menu. This field is actually related to a subgroup that I refer to, the CSL mentor subgroup. So I am already in that subgroup. So what you have to do is just start writing out their first name, and then you'll see my name comes up, and then you just choose me. If it's Dr. Berggren, our center director, you would just start writing her name. Give it a minute. You saw that it's doing a little circle thinking, so don't panic if they don't come up right away. But if you type it out and they don't come up at all, that means they're probably not in that subgroup and they need to be added. Then the next section is describing the role of your mentor in terms of this project. Why are they your mentor? What's their experience? Have they mentored it before? You don't have to go into their full bio. You can certainly include a link to their bio if you want, but really we're interested in their role for being your mentor for this project. Then we want to know who your community partner organization is. So you're going to write out their name. If they have a website, go ahead and put that here. And then the location where you're actually going to carry out your activities. I know that's a little tricky right now because we are probably going to be doing it virtually, but are you working in San Antonio? Are you working in one of these other cities? If you do choose other, make sure you write out the city. And then the same with the county. Remember, we talked about the donut counties earlier, so this is how we'll know if you're in one of those donut counties, or maybe you're in South Texas. If you're in San Antonio, then that is there. That's why that's the first one. And you can choose more than one. Then you're going to choose the start date for your project. And so you can go back in time if you've already started working on this project. Feel free to go back to your original start date and then your anticipated end date. Then we want to make sure that you have talked to your mentor about IRB review. So if you're not familiar with the Institutional Review Board process, then you can click on their link here. And they're the ultimate authority whether you need to go through IRB review. Honestly, most CSL projects are considered non-research by them. The types of activities that we're doing aren't traditional, full-on research. And so they usually designate it, not always, but usually they designate it as non-regulated research. And then, but by going through that process of review, which requires you to fill out an application and have them review it, which by doing the CSL grant application, you're actually doing a lot of the work already. But by doing that, they will issue you an official letter from their office that says the project has been reviewed. It's been determined by IRB not to be regulated research, or it's determined to be exempt, or whatever the status is. And then you have an IRB protocol number. And what that allows you to do is then submit your findings later on to a journal or somewhere else that nowadays most journals do require IRB review despite whatever the outcome was. So it's a good idea to do it if you haven't done it yet. If your project has already gone through this process in the past, you don't need to keep doing it each year. But if it hasn't gone, you should really consider going ahead and getting that designation. And if you have a letter, you can add it here as your attachment. Okay, so then we're going to go into the actual project details. And you're going to begin with a project summary. This is also has a maximum of 2,000 characters because we want it to be a succinct overview of your project. This is what the reviewer, how they're going to understand what you're doing. It's an orientation to them, to the rest of the application. So make sure you cover all the important aspects, what you're doing, who you're doing it with, who your mentor is, how frequently the project takes place, the things that we talk about here. And this should be a standalone summary, something like kind of like your elevator pitch, but it's a little bit longer than that. The number of people that you expect to reach through this project gives us an idea of your scope. So are you trying to reach 10 people who are part of a class? Are you trying to reach 200 people through a seminar that you're doing? Whatever it may be is fine. We just want to know how many people you're anticipating. Then you're going to write your timeline here. So this should provide dates as best as you can for all of your major components of the project. So this would include the time that you're preparing your needs assessment. We'll talk about that more. The time that you're actually doing the service. If you have dates of your actual activities, go ahead and put that there. The time that you're going to spend reviewing your data and coming up with your poster and your abstract. All of that needs to be in here so that we know this is something you can actually accomplish with your time as a student and your involvement in the other classes and the other things that you're doing. The February CSL conference is going to be February 5th and 6th. It's going to be over 2 days, and the poster session will be February 6th. So that's one timeline milestone that you'll want to be sure to include in there. The preparation by students. So this is another feature that distinguishes CSL from just traditional volunteerism. The fact is you're getting prepared to do this service. You're not just going out blindly into the community. You're hopefully attending some sort of orientation by the organization that you're working with, so you better understand their policies and procedures. You better understand their clients, their needs. You may have done some coursework. You may have attended some CSL toolkit trainings that are relevant for your project. So whatever you and your team are doing to be prepared should be specified in that section. Okay, then we're going to get into the community needs assessment. So this is where you show that you're meeting an identified need by the community. So there are lots of needs out there, and you all have a lot of interest in meeting those needs, but we want to make sure your project is actually addressing what the community partner has identified. So this section is where you talk about what you know about that. Maybe your community partner has already done some needs assessments that they're sharing with you. If so, you can talk about that. Maybe part of your project is doing a needs assessment yourself. And so how are you going to do that? Are you going to do some surveys? Are you going to pull some focus groups together? Whatever it is that is specific to your project, just make sure you describe. If you have some references, this is a good place to include those. And so the zip code of your target community relates to what I was talking about earlier with that map of San Antonio. So we want you to identify the either zip code or multiple zip codes that you're planning on working in, and what do you know about the health inequities experienced by people. So you may not know a lot, but hopefully you can learn some information from your partner or your mentor. Do a little bit of background research. This doesn't need to be a full research paper or anything. We just want to know that you've investigated it and you have a sense of why people in the community that you're helping are having these experiences. And then what kind of impact do you expect to make in your target population? And also, how are you engaging your community partner in the project? We don't want them to be off and separate. We want them to be walking alongside you and being part of the project too. That will definitely make it more successful. Okay, let me just pause there because I've been talking a lot and there may be some questions before I keep moving on.
I don't see any more questions.
Okay, great. Well, we'll talk now about the planning your intervention. And so this is something new that we added to the application this year. So if you've done an application in the past, you haven't seen this, but it's something that has been used in public health for a while that really helps get you, it's kind of like doing a logic model in a way. It helps orient you to what you're trying to accomplish. So in just one sentence, this is a big area, we probably should have made the area smaller, but just in one sentence for each of these four, you're going to describe the PICO, which stands for population. So who is your population? Be as specific as you can. And we've given some examples here to help you understand what that means. So uninsured African-American woman, age 40 to 64 years, residing in Bexar County, who make mammography appointments and then don't attend. That gives us a good idea of who you're targeting for your project. The I is for intervention. So what is your intervention? What is your service that you're doing? Such as a weekly Saturday farmers market. Who is your comparison group? So how do you know you're making a difference if you're not comparing your population with a population that isn't experiencing the intervention? So if you do have a comparison group, describe who they are. We understand that not all CSL projects will have a comparison group, but it's something for you to consider. If it's applicable, then you really should try to think about who could be, even if it's something like census data or general stats that you can compare your group to the overall stats. But try to compare it with somebody. If you can't, just explain that here, explain what you're doing and why it's not relevant. And then finally, what is the outcome that you're aiming to look at? And this is related to objectives that we'll go into, but something very simple, self-reported consumption of fruits and vegetables. You can state that in one sentence. And then if you do have a logic model, this is optional, but if you do have one, you can certainly add it here, and that will help the reviewers have a better idea of your overall scope as well. Then we're going to talk about SMART objectives, and I'm going to show you, I already showed you that template for how to write a SMART objective. There's also some other resources in that document section if you want to learn more about SMART objectives. We've included some more information. But you're going to start off with the healthy people topic and objective. Healthy people is our nation's agenda for improving the health of our citizens. So every decade they establish some markers that we're trying as a nation to achieve, and they cover most likely the topic of your project. They cover pretty much every health condition there is. And of course, now we're moving into a new decade, so they're currently working on the Healthy People 3030. I don't think that's released yet, so you can still use the Healthy People 2020 and just choose the best topic and objective that relates to your project. And then this is where you get to write your SMART objectives. So you are required to write at least 2 for your project. If you have additional SMART objectives, please go ahead and write them here. But know that the reviewers will be scoring the first 2 and not necessarily your extra ones. And then when you're writing objectives, you need to be thinking, well, I have these objectives, but how do I know whether I'm accomplishing them? And that's where you have an evaluation plan. And so you have your pre-post surveys, your data analysis, whatever it is that makes sense for your project and for your particular objectives. If you have the actual tools, we encourage validated surveys. So surveys that you have seen in the literature that have been validated are the best, they're the ideal. If you don't have something that you can use, you can create your own assessment tools. And you know, if you have them ready to go, you can go ahead and add them. This is optional, but this will help the reviewers see that you're really been thinking ahead about how you're going to evaluate your outcomes. And then finally, you're going to have reflection. This is another component that distinguishes service learning from volunteerism. So in service learning, you actually have a mentor who's guiding you along the process from the very beginning to the very end. And you need to document here, how are you engaging in that reflection with that mentor, as well as with your other student team members, and possibly also with your community partner. And we don't need to know, you know, a lot of detail. We just want to know what your plan is, that you're going to meet regularly every Tuesday, or, you know, of the first Tuesday of each month for the rest of the project, whatever it is that you're going to do. just write that here. And then the application ends with your plans for presentation and sustainability. So you will, like I said earlier, be presenting at our CSL conference. That is an opportunity that we offer all of our grantees. But there may be some other academic conferences that you're already planning on. If you have that, make sure you put that here. So that's the scholarly component. Then make sure you also talk about making your results available to your community partner. So remember, the whole project is being done because you're meeting a need of the community partner. And you need to make sure that you get this information to them and present it to them in a health literate way, in a way that makes sense to them. So some people have done presentations at board meetings, for example, or even gone to city council if it was relevant for the community as a whole. So just think about what would make sense with your partner and how to get that information to them. And then sustainability is you're working on this project, you may get something really great going, and then next semester or next year you have to leave and maybe you graduate, or maybe you're just not able to work on the project anymore. Well, what is the community partner supposed to do? Now they've got this project and we don't want to leave them hanging. We don't want to be drop in and drop out kind of people. So have a plan for sustainability. That may mean that you're going to recruit other students, upcoming students, to take over the project, and you need to have a plan for that. Or you may want the community organization to start running this by themselves. And so that's fine, whichever way makes sense for your project. You do need to have some references. You don't need a lot, but your goal should be about 5 solid references. So that means not just websites of organizations, but actual journal articles or something similar to that, to show that you've done your homework and you really know what you're talking about. We want to make sure that's cited here. And then the budget will be the next component. And so we do have a budget template that's in that document section. It's an Excel spreadsheet, and I'll show it to you if we have time here. And then you need to justify each of your budget items. This is very standard in a grant application. You have your wish list, but then you need to justify why you're choosing those items and why it's needed in your project. This gets a lot of scrutiny by us, not necessarily for points in terms of your scoring, but it helps us know whether we can at least partially fund your project, which components of it we can fund, which components maybe somebody else has resources for you. And so make sure you do a good job with documenting that. This is where you'll add your 2 letters of support from your mentor and your community partner. This is where you can get that transfer of funds form I talked about earlier, and you'll upload it here. And then finally, here are the grant requirements. So by submitting this grant, you are agreeing to these terms, which are things I've already told you about, and then you're going to submit and save your draft. And so I would just want to point out, this is the community service learning document section. So when you go to our community service learning group in Engaged, in the overall Engaged, you'll find, first go to CMHE, the Center for Medical Humanities and Ethics, and then go to Community Service Learning. And then under More Tools here, you'll see Documents. These are all documents I've been referring to throughout the presentation. I do want to open up the grant budget just to show you what that looks like. But this is where you'll also find today's PowerPoint, you'll find the rubric, you'll find the application template, all of the different resources that would be relevant. And then after this, I will go ahead and end and take questions since we are running at 1 o'clock. But let me just show you this real quick so you can see what it looks like. Jackie, are there any questions in chat while this is opening?
No, there's no questions, but if anybody wants to chime in and ask one while we're loading up here.
Okay, while you're thinking of your questions, hopefully you can see this on your screen. We want you to use the standard template rather than coming up with your own, which should make things easier for you as well. So you're gonna put which cycle you're in. Right now we're in fall of 2020, the name of the grant leader, your mentor, your project title, your total request, and then you're gonna line item each of your expenses with the quantity and the cost. This formula will automatically take into account the quantity and costs and add that up to you, and then you'll get your grand total down here. So it should make things a little bit simpler and more straightforward for you. Okay, with that, I'm going to go ahead and stop sharing my screen, and yeah, if anyone wants to ask any questions, feel free to. Otherwise, we will go ahead and adjourn.
Sorry, really quick, where were the question, or where were the documents? Where was the place we access those again?
So it's in the Engaged platform. So there's a link to Engaged on our CSL website. It says Engaged. There's other ways. You can also get to it through quick links on the UTHSCA website. So when you go into Engage, you're going to see that there are several large groups. One of them is the community, or sorry, one of them is the Center for Medical Humanities and Ethics. And then in the CMHE, you'll see different subgroups. There's one for there's a subgroup for each of the clinics. There's also one for just community service learning. So you'll go to that one, and then you'll go to on the left-hand side, you're going to go down to more. And then you'll see documents when you click on the more. And when you click on documents, you'll see all of those items.
Perfect, thank you.
I just uploaded in the chat, added the CSL webpage, and on there you'll see Engaged on button on the right.
Great. All right, any other questions? Okay, well, great. Hopefully that was clear. Once you start getting into the process, if you have questions, feel free to reach out to either me or Jackie. We both can help you. And good luck to you. Thank you for thinking about doing service learning during this crazy time that we're in. But the truth is the need is greater than we've ever seen. And you know, I hope you can come up with a good project. We'll be looking forward to receiving your applications. Thank you all very much, and have a good rest of your day.